Hi, I'm Dr. Rasya Dikshit, a consultant dermatologist and cosmetologist in Bangalore. So today we are discussing what are the different effective solutions for hair loss, and this treatment today we are discussing, it's called Platelet Rich Plasma Therapy. So what is a platelet? Let us understanding this way. This PRP treatment is based on the platelets. A platelet is a normal cell in the blood and it is involved in tissue repair, clot formation. What it does, it has lots of growth factors. It signals cell proliferation and tissue remodeling. So whenever there is an injury, a platelet is very required. But the same platelet is used in platelet-rich plasma as an effective, promising treatment that contributes to hair regeneration. It is autologous concentration of platelet. That means the same person's platelet is used in the plasma and it's enriched with several growth factors. These growth factors, they act on the stem cells of a hair follicle. They stimulate the new growth as well as development of the hair follicles. And these growth factors are also help in healing of the skin. They heal the damaged hair follicles. So this is a very safe treatment because your own blood is being used and your own platelets are being used. When they are injected into the scalp, they release lot of growth factors and cytokines. And they are of many different kinds like platelet-derived growth factor, insulin-like growth factor, transforming growth factor beta. And if you can look at the papers, there are a lot of scientific papers that show that they promote a lot of collagen regeneration, fibroblast activation, extracellular matrix stimulation, cell proliferation, angiogenesis, that means new blood vessel formation. And all this together are needed for the growth of a new hair. And it is not only to grow the new hair, but also to support the hairs which are becoming inactive and they make them re-enter into the growth phase, but also PRP works on the dormant hair follicles. The platelet-rich plasma is produced using the patient's own blood. So the blood is collected like how it is collected in a regular blood test into an anticoagulant vial. It's a sterile vial. That means there's nothing already inside it. And it prevents any platelet activation and blood clotting because there is some anticoagulant in it. This plasma is then centrifuged. So when you centrifuge blood, it differentiates into the cellular component and the plasma component. Platelet, being a very small cell, is suspended in the plasma. Then the plasma is then removed from this tube using a sterile, disposable, single-use syringe, and then it is used ready for treatment. What about the treatment? In the patient, we apply an anesthetic cream or a numbing cream, and then after about 30 to 40 minutes, that much time it takes for the platelet-rich plasma to become ready. Then we cleanse the area with an alcohol swab, and then the treatment is started. First treatment we do is a treatment called microneedling. Microneedling, what we do is we use a device like a derma pen or a derma roller to make some invasive small holes into the upper area of the scalp. This helps us to deliver the PRP without any pain. And because the scalp is a very tight area, it is very difficult for us to deliver it without causing some amount of derma rolling, so that the scalp becomes a little bit more easy to inject. Next, we use a very tiny needle called microneedle, and then we inject the plasma about 0.1 ml in each area in the whole affected area of the scalp. Once this injection is done, the patient is allowed to rest for about 10 to 15 minutes, after which he can go back to work immediately on that day, or he can wash his hair on the next day. Now comes the question, who should be a good candidate for platelet-rich plasma? Actually, because this treatment is such a safe treatment, because this treatment involves your own blood, no additives are there, anybody is a good candidate for platelet-rich plasma. And even somebody who's pregnant or somebody who do not want to do medical treatment for some reason, minoxidil allergy, is still a good candidate for platelet-rich plasma. It can be started as early as 20 years of age, and there is no age limit to the treatment. What are the benefits of PRP treatment? PRP treatment is autologous in nature. Autologous in nature means the blood is taken from the same patient on which the treatment is being done. That means there are no chances of infection, no chances of rejection, and it is definitely effective. As platelet is a natural product that is extracted from the patient, we don't have to worry about any side effect. We don't have to worry about any allergy to the patient. It involves very little recovery time. That means a patient can go back to their daily work right after the treatment, but we allow them to shampoo the hair probably one day after the treatment. What the advantage of PRP is that it increases the hair density and it also improves the quality of the hair. It also improves the quality of the patient's life. It is effective in hair loss, in hair thinning, in balding, both in men and women, and it is definitely something that you should try if you have not gotten good result from your medical treatment. But please remember that a cause of the hair loss using the medical history, physical examination, blood test has to determine the cause of the hair loss first, and then that has to be treated simultaneously before you go in for your platelet rich plasma treatment. So the most important thing is you meet with your dermatologist first, understand what is the cause of your hair loss, and then start your platelet rich plasma when it is recommended. The results of platelet rich plasma are very visible after the 3rd to 4th session with an increase in density. However, you have to use medical maintenance treatment to prolong the effects of treatment, and we usually recommend that you do your treatment once every year to maintain these results.